Welcome, curious minds. Today, we delve into the intriguing world of asthma. This journey promises to challenge and enlighten. So, let's embark on this adventure together. Dive in. Allergens, being substances that can incite an allergic reaction, are known to instigate asthma attacks in people who are asthmatic. These allergens range from pollen from trees, grasses, and weeds, to dust mites, mold spores, and particles of cockroach waste, as well as pet dander. When these allergens are inhaled, they stimulate an overreaction of the immune system, which results in inflammation and narrowing of the airways. Furthermore, respiratory infections such as the common cold, flu, and bronchitis are capable of triggering an asthma attack. These ailments induce inflammation and mucus production in the airways, complicating the process of breathing. It is worth noting that children with asthma may present more severe symptoms when they contract a respiratory infection. In some people with asthma, exercise can provoke symptoms, a condition that is referred to as exercise-induced bronchoconstriction, EIB, or exercise-induced asthma, EIA. However, this shouldn't discourage people with asthma from engaging in exercise. With adequate treatment and management, most asthmatics can exercise normally, though they might have to take certain precautions, such as using an inhaler before exercising or warming up slowly. Air pollutants and irritants, including smoke from tobacco, as well as other air pollutants like smog, chemical fumes, strong odors, and particulate matter, can also instigate asthma symptoms. As a rule of thumb, asthmatics should aim to minimize exposure to these irritants as much as possible. Weather conditions, particularly cold air, temperature changes, and high humidity, can lead to an asthma attack. Cold air can constrict the airways, complicating the act of breathing. Rapid changes in temperature can also incite symptoms, and some individuals discover their asthma is exacerbated in specific weather conditions, for instance during a thunderstorm. Strong emotions and stress are also known to prompt an asthma attack, potentially due to changes in breathing patterns or increased inflammation in the body. The use of relaxation exercises, mindfulness, and stress management techniques can be beneficial in managing emotional triggers. Moreover, certain medications can provoke an asthma attack. These include aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, beta blockers used to treat conditions like high blood pressure and heart disease, and some types of eye drops. If you are asthmatic, it is imperative that your healthcare provider is aware so they can avoid prescribing these medications if possible. For some asthmatics, food allergies can trigger an asthma attack. This includes allergies to foods like peanuts, shellfish, cow's milk, eggs, and soy. Some food additives, such as sulfites, found in dried fruit, wine, and shrimp, can also stimulate asthma symptoms. GERD, or gastroesophageal reflux disease, is a digestive disorder in which stomach acid frequently reflows back into the esophagus, irritating the airways and triggering an asthma attack. If you have both asthma and GERD, managing the GERD can aid in controlling your asthma symptoms. Finally, conditions like sinusitis, allergies, and hay fever, which cause inflammation in the airways, can provoke an asthma attack. Sinusitis is an inflammation of the sinuses, usually due to infection. Allergies and hay fever incite an allergic reaction, leading to inflammation and swelling in the airways. Identifying and avoiding your personal asthma triggers is a key part of managing the condition. This usually involves keeping a detailed diary of your symptoms and activities, and may also involve tests like allergy testing or a bronchial challenge test. It's also important to work closely with your healthcare provider to develop a personalized asthma action plan, which includes information on which medications to take and when, how to avoid triggers, and what to do in an emergency. Thank you for joining us in this exploration of asthma. We hope you found it enlightening and engaging. Remember, the journey of learning never ends. Until next time, keep exploring, keep questioning, and stay curious. Farewell.